Welcome back to the Dr. Rich channel. Thank you for viewing all of our videos. We've had such an overwhelming response from our reacts to Glaucomflecken. You get what you ask for. Here's another Glaucomflecken reacts. Today we have the anesthesia provider.
No!
Oh, no!
That may be beyond my abilities at the moment.
Seriously?
Today we have in studio real live anesthesiologist Jessica Compean. You can say hey.
Oh, hi.
And away we go.
Okay, anesthesia,
That's you.
surgery.
That's me.
Do you know why you're both here today? I don't know, but I'm sure it's his fault.
That's probably true.
Do not drape glare me. You're here because the two of you refuse to get along. Oh, come on, we're fine. Surgery? Yesterday, you took anesthesia's chair and replaced it with a stool. So? A comfortable chair is vital to preventing anesthesia-related burnout.
So true.
Is that accurate?
Yes.
Although I will say that, at least for robotic surgery, we're a little bit bougie about our chairs as well. We love to sit. We got a little armrest. Been trying to get a coffee holder for a while.
No, that's very nice.
They're not good with that.
I was very uncomfortable. In anesthesia. In retaliation, you stole and hid the surgeon's compression stockings. Well, he deserved it. Anesthesia, you know a surgeon's unhealthy obsession with operating results in physical breakdown at a very early age.
Is that true?
Yes.
Do people wear compression stockings?
No.
I don't wear compression stockings.
They're so uncomfortable.
Maybe I should. Although I don't stand either because I'm a robotic surgeon, so I get to sit down. So, do you guys wear?
I don't stand either. I sit down.
Right. But you get to surf the internet. I have to
That's true.
actually do stuff.
Don't give away all our secrets.
I know, right?
The two of you need to end this. It's time to take down that drape. What? No. It's really stupid over there. Says the person who can't control blood pressure. Well, maybe you should stop losing so much blood. I told
Does
you.
that ever happen?
This is the blood-brain barrier. The brains and the blood.
That's a good one. Haha. So that never happens, right? You never have issues where you can't control blood pressure and it's always your fault.
Of course
it's never
not.
blood loss with a surgeon.
No.
I've never had more than 50 cc's of blood loss.
That's actually
okay,
true.
what's in the cell saver? Tomato juice? Yeah, maybe. You're not allowed to bring food in the operating room. I've tried. Well, I wouldn't lose blood if you'd control the blood pressure. No, you...
You guys always bringing snacks in?
I'm not admitting to anything.
All right, you cannot confirm or deny.
Nope.
So what is in the cell saver? Is it tomato juice?
Absolutely not.
Okay, so Cell Saver is a technology. It's particularly helpful in circumstances where there's an anticipation of a higher blood loss or in patients who can't or won't accept blood product. It's a technology where blood is actually collected instead of going into a regular suction canister during the surgery. It goes into a unit repository that is collected during the surgery. It is then centrifuged down so that the viable red cell mass can then be transfused back to the patient at the end of the surgery. Now this is all in theory since I've never lost more than 50 cc's of
course
blood.
not.
So. But other surgeons find this helpful?
Very helpful.
So my practical application for that would be two circumstances, at least for GYN, uro-GYN surgery, would be a very large, we're talking about greater than 10, 15, 20 centimeter myomectomy, so the removal of a fibroid for the uterus. Now the reason that this might be a higher blood loss surgery is because there are 4 pedicles that supply blood to the uterus and those all have to be maintained and left intact while you're surgically removing the fibroid. And so there's just ongoing blood loss that whole time. And sometimes for these larger fibroids, you can look up and all of a sudden there is like 500, 1,000 cc's of blood loss. So typically, and correct me if I'm wrong, but typically the perfusionist is able to give back about half of the blood that's lost during the surgery.
Correct.
And that's your own blood. So you're not getting transfusion from a rando. So, and that there are several important keys about that. One of which, probably the most important thing, is what's called a transfusion reaction. Right? Why don't you tell us about that?
Oh, don't make me start
No,
that.
you're not gonna be nerdy. I didn't come prepared for this. I didn't be educating people. So probably the most common and perhaps severe side effect would be a transfusion reaction when there are antibodies that the patient has that actually see donor blood as foreign and creates inflammation and can actually even lead to death. All that being said, not tomato juice.
You're not allowed to bring food in the operating room. I've tried. Well, I wouldn't lose blood if you'd control the blood pressure. No, you wouldn't lose blood if you stopped cutting through all the arteries and veins. That's enough. I didn't want to have to do this,
What's he gonna do?
but you've left me no choice. What do you mean? I have to put on the hat. Oh, no, come on, we'll be good. Charge nurse. Now, if you don't play nice, there will be consequences. Like what? Maybe I'll turn off the Wi-Fi.
Oh, dude.
Oh my God, no. Be nice.
Like, you might retire.
Yes.
If there was no Wi-Fi.
We'd be miserable.
Could you imagine?
No, we'd be miserable.
Yeah.
A 4-hour surgery with no Wi-Fi?
Can't
What is
have that.
this? Third world country?
No 4-hour surgeries.
Maybe I'll set the OR room temperature to 70 degrees.
I'm leaving.
That's so
We'd
ballsy.
love it. Let's do
Keep
it.
this up.
So they're actually, the only reason that the OR is kept like at the frigid temperatures in the 60s is for operator comfort. Like the surgeons and all the staff, except for anesthesia and nursing, we're all draped in layers of stuff, sometimes lead, and it gets very hot. So there's no actual patient benefit to a frigid temperature, and you can actually check that out and more OR facts in this video here.
And you're both going to be forced to attend internal medicine grand rounds.
No.
You wouldn't. Try me.
Is there anything worse than internal medicine going around?
Absolutely not.
I can't. I need at least 11 cups of coffee to survive that.
Sweet. Sweet.
Is this Candy Crush? I've never played it.
Perhaps you'd like to crush candies another time.
Sugar.
Sorry. Now, how are things going with surgery? Fine. Really? Because I see here that there was an incident in the OR yesterday. Anesthesia. For the last time, do not bring surgical drapes into this office. Now, would you like to tell me what happened?
Do you bring them when you go to therapy?
Well, according to the...
It's the imaginary drape.
The imaginary. I bet you could drape glare even without a drape.
Oh yeah, I don't need a drape to glare.
Well, according to the circulating nurse, where did you get coffee? Oh, I don't know. It's one of the perks of anesthesia. Somehow we just end up with coffee.
All right, so there's probably one thing I'm jealous of, right?
Well, according to the circulating nurse, you wrote, the general surgeon is a Malampati 4 on the whiteboard. Yeah, so? It is inappropriate to make fun of people's difficult airways. Well, he started it.
What's a Malampati for?
So in anesthesia, we evaluate a patient's airway, and they're graded from 1 through 4, 1 being the easiest and 4 being the most difficult.
Okay, so I'm probably 4.
Let me see. Open your mouth. Ah, you're a 1.
Sounds kind of dirty. Malampati?
It does.
And then last week, at the end of a 10-hour case, you asked the general surgeon how his work-life balance was going. I was just trying to make small talk. Anesthesia, you know surgeons don't have work-life balance. That's not my problem. We need to work on your conflict resolution skills.
So that is kind of one of the elephant in the room for medicine, is that there is a alarmingly high rate of physician burnout among internal medicine doctors, surgeons, high divorce rates, high suicide rates. Virtually every specialty, except anesthesia, because they're at the golf course at 3 o'clock every day.
We have great work-life balance.
That's right. So go to anesthesia.
Oh, come on. No, we don't. Let's work through some scenarios. I'll be the surgeon. Anesthesia, the patient's moving. Can you do your job, please?
There's the glare.
Is that so that you can't see the rest of your
Yes.
facial
Yes,
expression?
we're mouthing to you. You just can't see it.
Yeah, it has some expletives going on there.
Let's try a different approach. Hey, dude, how's it going? What? Excuse me, we're in the middle of a session. Hey, what's up? You want to take a break? Oh,
Every time I turn around, it's like, Jessica, can you? Oh, it's Bob now. You know, they're
Jessica's
like,
on a break.
Always taking breaks. No, not during therapy.
This is not a good time. Come back in 10 minutes.
So does that ever happen where you like don't give somebody a break if they come, or they don't give you a break?
They get mad, yeah.
Yeah?
You hear about it.
Oh my God.
Oh yeah. It's the unspoken rule.
You have to.
You get a break.
You get a break. Well, Jessica, I want to thank you for coming in to help us out with this anesthesia-themed Glaucomflecken Reacts videos today.
It was my pleasure.
If you enjoyed this video, make sure you subscribe, because 6 out of 10 of you have not. And check out these other Glaucomflecken videos here, and this one here, and that one there.